Hello everyone, this is Fran Brent. I'm one of the jurors for the case of Jennifer versus AU Hospital. I've been a healthcare worker for over 5 years and I work in a hospital setting for over 2 years. I understand the deep concern in the medical community that we have when it comes to healthcare, health information. Healthcare organizations need to promote and maintain secure record of patients' health information at all times, regardless if the patient is still in hospital or not. Because from the very moment the patient got admitted, it is the hospital's obligation to maintain, abide laws that protect patients from having their health information exposed. There is HIPAA, which stands for Health Insurance Portability and Accountability Act, and it was initially created to protect health care coverage for individuals who lost or changed their jobs. It was developed in 1996 and became part of the Social Security Act. According to the American Medical Association, failure to comply with HIPAA can result in civil and criminal penalties. It also says that offenses committed under false pretenses allow penalties to be increased to up to $100,000 fine, with up to 5 years in prison. Offenses committed with intent to sell, transfer, or use individually identifiable health information for commercial advantage, personal gain, or malicious harm permit fines to $250,000 and imprisonment for up to 10 years. AU Hospital seems to believe that it was not a fault and did not release any information without proper authorization. It further says that it only used information found in a subpoena to justify the use and disclosure of the information authorized by the patient, the plaintiff. It says that it only disclosed, quote, nothing more, nothing less, end quote, than what found on the subpoena. AU also claims that its employees are trained to protect patients' private information. Hospitals do invest much time, energy, and money on training and trust its employees' judgment and ethic to handle important aspects of health information management, but we cannot guarantee that its employees are effective in doing so. The article found in American National Library says that in regards to security and compliance to HIPAA, the more automated the hospital or practice is, the greater its need to reevaluate the security of the network infrastructure. The plaintiff Jennifer has proved that she signed the authorization for disclosure and the same would restrict sharing of health information. Unfortunately, on the case, we are not provided with the damage that the sharing of her information caused. But we know that it's a serious issue, and it could cause much damage, such as the case found back in 2011 in Indiana. A medical group could not collect payment for treatment and send the patient to collections. In providing the unpaid bills to the collections attorney, practice staff failed to protect sensitive information, and when the attorney filed the bills with the court as part of the collection action, the patient's record became public. Unfortunately, the patient had AIDS, and his or hers, we are not provided with sex of the patient, became public. Of course, the patient also sued the medical group and won the battle. In this case, AU Hospital does not offer any information on how it attempted to stop the sharing of information of Jennifer's. Jennifer did trust AU and should compensate it for any damage brought by the exposure of her PHI.